luncheon conversation today from our speaker is very much rooted in the basis of what you've been hearing over the last 2 days. We talked about the 3 pillars on which this summit is built, on which the immunization partnership is built, and basically on which most of the work that we are doing are built. Education and outreach, to reach out and teach the best possible practices, which is the second, and the advocacy that is required in order to institutionalize those 2 areas, to institutionalize in a stronger, in a sustainable way, the education efforts that have been discussed that are necessary from the stage over and over and over again, to make it a given that the best practices that we know result in the best possible health outcomes are a given, not an option. And in that way, every one of us is involved in the 3rd pillar of advocacy. Every time you have heard a call to action, every time you have asked a question that allows you to be in better action, every time you have committed and made a decision to do something differently based on what you've heard here, you are also answering the call to advocacy. And what you will hear in our next speaker, who is a champion for advocacy for myriad health issues, but specifically right now for vaccine preventable disease and immunization practices and policies that we know have amazing life-saving outcomes. It is my pleasure to introduce Nidhi Nakra. Who apparently needs no introduction. Okay. That is awesome. That is what you want. And so you recognize the importance of the work that Nidhi has done over the last few years in this arena. For those of you who don't know, she currently serves as the Director of Education and Advocacy for the Immunization Partnership in Austin, Texas. Prior to that position, Nidhi worked as a CDC Public Health Advisor for the Los Angeles County Immunization Program. There, she was a member of the senior management team that directed the Advocacy, Evaluation, and Promotion Unit. Prior to her CDC post, Ms. Nakra managed the county's African American and Latino interventions and conducted extensive research on immunization disparities. During her time in Los Angeles, she also served as a technical advisor for the World Health Organization in the Solomon Islands, where she supervised their successful 2006 measles campaign. Ms. Nakra began her career as a health services consultant for integrated healthcare delivery systems and managed care companies. And how important is that as a background for the kind of work that we're trying to advance right now? She received her master's in a Master's of Public Health degree in Public Policy and Management from Emory University. She has a passion for yoga, dance, and hiking, and she and her husband live in Austin with their 2 beautiful children. A woman who has been amazing in the leadership that she has brought to help galvanize all of our efforts in the right direction, to coalesce us together. Please join me in a warm, warm welcome for Nidhi Nakra.
Gosh, don't you love that Emmy music? Gosh. Thank you so much for that warm welcome, Tracy. And I am so delighted to be here today to help in not being the last speaker, but help in closing out this amazing summit. It has been an amazing couple days, hasn't it? Have you guys enjoyed it? It's pretty incredible, right? So I'm going to be discussing the findings from our 2014 biennial summit, 2014 biennial publication. But before I do, I want to ask you a question. Immunizations is hard work. It's constant. There's always babies being born. We have to continue to inspire ourselves. And we need that inspiration that gives us the strength and the resolve to do what we do on a daily basis and to do the incredible work that we do in the field of immunizations. So I'd like to ask you to just take a moment and think about what inspires you. It might be a person, it might be an experience or a story, but just take a moment to think about that and then hold on to that as we discuss the rest of the presentation. Here's my inspiration. Yeah, can't you imagine yourself just sitting on that white sandy beach, looking out to that clear blue water, sun beating down? Yeah, it's not the only reason why this is an inspirational place for me. But this is the Solomon Islands in the South Pacific. And in 2006, I traveled here as a technical advisor for the CDC to implement a measles campaign. Fiji had just experienced a measles outbreak, and the World Health Organization was worried about importation. And so they sent a technical team, me included, yes, I totally lucked out on the assignment, to ensure that 95% of people, 95% of children, I should say, between the ages of 1 and 4 years were immunized against measles. Needless to say, I was very happy to make this my home for 3 months. But when my team arrived, less than 50% of our target audience was immunized. And just to give you some perspective, the Solomon Islands spans approximately 900 miles. There's over 1,000 islands, over 300 of which are inhabited. So you can imagine the daunting task: accessing hard-to-reach remote populations, lack of awareness about vaccinations, widespread misinformation due to deeply embedded cultural and traditional values, limited resources and staff. Wait, are we talking about Texas or the Solomon? Yeah, no, right. These are not unique issues. And for me, this was a very profound experience in immunization advocacy, and it continues to inspire me today. Our team worked in concert with the local health ministry to mobilize and implement what I'm very proud to say was the most successful campaign in the history of the Solomon Islands. But we did it because we worked collaboratively, and we worked toward a common goal. We leveraged our individual strengths and individual potential, and we coordinated a multifaceted campaign that involved several key components. We conducted town hall meetings where we gathered information and feedback and addressed various questions and concerns. We garnered support from our local health officials and tried to get support from the high-level key decision makers so that could then trickle down to their constituents. We worked and partnered with the radio, our mass media, conducted press releases and announcements. We empowered our trusted village chiefs and women's groups and churches, people who had a connection with the community, to talk in culturally appropriate and sensitive language to those around them. We've trained our providers, we mobilized our community, and we conducted mass vaccination clinics. And in the end, we exceeded our goal and ensured 97% coverage. And I was so excited and empowered to see the power of mobilization and how a group of people with a combined purpose can band together to accomplish such amazing things. But when I look around this room, I see a very similar group. And when I work with you in your stakeholder meetings, in your coalitions, when we partner together to educate the community on the ground, advance immunization policy, we're all motivated around a common cause. We're all here to enhance immunization coverage and prevent disease. And with the combined efforts and intentions of everyone in this room, the potential for success is amazing. So I've been privileged to be a part of the Immunization Partnership for several years, and one of my favorite parts of this job is our stakeholder engagement activities. I love going out and traveling across Texas and meeting you all in your local communities, talking to you all about what are some of the issues and priorities that you're facing, taking that feedback back gathering those issues, gathering those insights, and translating all of that information and your voices into this biennial publication. Since 2008, the partnership has conducted 26 stakeholder meetings in 10 cities, including El Paso, Dallas, Austin, Houston, Fort Worth, San Antonio, Brownsville, McAllen, and Galveston. We've administered 4 statewide surveys and engaged over 2,000 participants through our stakeholder meetings and our surveys. Many of you have participated in our meetings, taken our surveys, and I so thank you for speaking up and making your voices heard. This is the 4th biennial publication of its kind, and what a powerful resource it has become. Every 2 years, the publication is distributed widely across the state to elected officials, administrators, key decision makers, clinicians, advocates, and it has supported so much change. Health education efforts on the ground, systems changes at the provider level and office practices, and it's contributed towards positive immunization policies in the state. You have had a hand in the successes that have been experienced throughout the years, and these are just a few. Your comments and recommendations have supported meningococcal vaccination requirements for college students since 2009, pertussis education for parents, healthcare worker policies, childcare policies, and expansion of consent for minors. Many of you know these 2 very special individuals and have heard their stories over the past couple of days. Jamie Shanbaum, a meningitis survivor, and Nico Williams, a Texas A&M student who lost his life to the disease. Jamie and Nico were not afforded the vaccine opportunities that we have today, and they suffered because of it. But because of your help and your advocacy and your voices, college students in Texas are now protected from this devastating and debilitating disease. So Texas has experienced numerous successes, but we also could continue to be faced with many issues, many that you've heard over the last few days. Issues like pertussis. Last year, Texas reported almost 4,000 cases of pertussis, a 50-year high. Measles is making a comeback, and Tarrant County experienced an outbreak in 2013 in a largely unvaccinated population. The number of vaccine exemptions continues to rise at an exponential rate. Adult immunization rates remain low, well below the Healthy People 2020 objectives. Although we're seeing HPV vaccine creeping up, it's still not increasing at a rate that we would expect. The field of health information technology is advancing, and we need to keep up with documentation, interoperability, interface, data exchange, and we're seeing new and emerging threats that need to be monitored. These are real and daunting challenges, and you might be asking how? How are we going to do it? And I think it begins, in one place, with this tool. It begins with this publication. You all had such incredible recommendations and suggestions, and I think one of the hardest parts of writing this publication was trying to figure out what not to exclude. I had so many comments, pages and pages, and so I thank you again for making your voices heard and for offering those insights. So this publication this tool is just one tool for fighting that good fight and for promoting immunizations. And so let's just highlight a couple of those key recommendations. Now, we've talked a lot about pertussis the last couple days, and Dr. Munoz made several excellent suggestions in her talk yesterday. And one of the primary suggestions that we heard time and time again from our stakeholders was ensuring that pregnant women are vaccinated in their 3rd trimester of pregnancy to avoid transmission of pertussis from adolescents and adults to young, vulnerable infants and children. In fact, 91% of our survey respondents said they would support a proposal that requires pregnant women in their 3rd trimester of pregnancy to receive information about pertussis and the importance of vaccination. Now, for many years at our stakeholder meetings, we've heard concerns about the Texas Immunization Registry, MTRAC. And we've taken into consideration all of your concerns, all of your recommendations, and we're excited to say that we've gathered that feedback and shared that with the Department of State Health Services, and they've incorporated many of those recommendations in the M-Track replacement project. And I know that Mark and Vivian talked about this in the last session, but for those who may not have been able to attend, this is going to be in a really incredible transition. We're going to see so much new functionality that's going to help advance the M-Track, the immunization registry, its interoperability, and its ability to interface with other technology. We're going to see bidirectional data exchange, expanded inventory and ordering functions, enhanced reminder and recall capabilities, more detailed forecasting, and better reporting options. However, there's still some challenges that continue to remain, and we hear a lot of that, and we've heard of some of it in the last couple of days as well. And one issue that we've heard over the years is the issue of the consent process, and how this is a real challenge for many of your providers, and how it's an hindrance to accessing robust immunization information, and how it's a hindrance to providing good quality care. Now, Representative Howard talked about how we moved this through the House last session. We got it further than we ever have before. The Immunization Partnership is committed to this issue, and we're committed to making your voices heard in the legislature. So we're hoping to continue to push this next session, and we'd love to have your support. Another issue that was raised involves consent for adults. Right now, statute indicates that adults who are in the immunization registry, who are under the age of 18 years of age, must re-consent to have their information included by 19 years of age, otherwise that data becomes purged. Well, we all know that there's many opportunities for adults to access that information and need that information, whether it be for healthcare professions, military, or for college vaccination requirements. And so this is another issue that we intend to fight for next session, is to extend the time that that data is retained in the immunization registry beyond 19 years of age. So Texas allows parents to exempt their children for medical, religious, and philosophical reasons. And I think you all have seen a graph very similar to this that Dr. Lakey spoke about yesterday, but we've seen a significant rise in the number of exemptions that have been claimed due to reasons of conscience. In the past 10 years, we've increased from a little over 2,000 to over 38,000 exemptions. Now, many of our participants felt that vaccine hesitancy and concerns about side effects, pain, and the frequency with which vaccines are given is the root cause for the rise in the vaccine exemptions being claimed. However, 3 out of 4 of our respondents believe that the process for getting an exemption is too easy in Texas. And they felt strongly that Texas should implement policies that require individuals to either consult a healthcare professional or watch an online summary on the risks and benefits of immunizing before claiming exemption. And this is a trend that we've seen in exemption policies across the nation. There are a few states, Washington, Oregon, and California, that have passed legislation of this kind that has made exemption policies much more stringent. We've also heard a letter of support and announcement from the Association of Immunization Managers, who agrees that states who do not have philosophical belief exemptions should not have them, and those that do should institute strict immunization exemption policies in order to prevent exemptions from being claimed for reasons of convenience as opposed to conviction. So a large percentage, over 90% of our survey respondents, also felt that DSHS should better track exemption rates and to make that information more publicly available on the ground. And one suggestion was to make that data more publicly available at the school level so that parents will feel better informed about the potential risks that are posed to their children and take action to reduce that transmission. Low vaccine uptake among adults continues to be an issue, and some of the primary barriers that we heard were related to cost and access. And what we observed is that many adults are foregoing vaccination either due to competing priorities or because they don't have the financial resources to cover co-payments or other out-of-pocket expenses. One stakeholder quoted, "Many seniors are on fixed incomes, and if it comes to paying $25 for a vaccine, or buying $25 worth of groceries, the groceries will win every time. We've also seen that the changes to the DSHS Adult Safety Net program have also had an impact on vaccine access and availability, particularly for the underinsured population and those who need meningococcal vaccinations to attend college. Another quote, "They could use help in obtaining these very valuable vaccines. Adult clients are unable to pay out of pocket for immunizations, and they depend on the local health department to provide all vaccines." So many suggestions were made, but the one that resonated most was that they encouraged the Department of State Health Service to expand the Adult Safety Net program to include all ACIP recommended vaccines in their formulary, particularly meningococcal and zoster vaccines. A last quote, "The high cost of MCV4 places the individual in financial strain. Adults find this to be a barrier to enrolling into school or meeting the prerequisites to obtaining a job." So we've talked a little bit about the meningococcal vaccination requirement already, but just to highlight how this legislation has transpired. It began in 2009 with Texas leading the nation as the first state to require all college students living on campus to show proof of meningococcal vaccination. Now, there were two events that led to the expansion of that law in 2011. One was the updated CDC recommendation for a booster dose of meningococcal vaccination at 16 years of age, and the second was the tragic death of Nico Williams. So that law was expanded in 2011 to include all college students up to age 30. The law was then revised again in 2013 in order to align state policy with science that shows that the incidence of meningitis peaks between the ages of 16 and 22 years when majority of kids are in school. And so that maximum age range was dropped from 30 years of age to 22 years of age. Now, the Immunization Partnership has been following this legislation across the industry and for many years. We've been talking to stakeholders, hosting conference calls, talking with individuals at the institutions of higher education as well as the Texas Higher Education Coordinating Board. And our findings have shown that the implementation of this requirement has been largely successful, but there are some challenges that remain. The cost of the vaccine and the removal of the meningococcal conjugate vaccine from the Adult Safety Net program were the primary barriers. Now, some participants have suggested that we might be able to combat some of those barriers related to cost by requiring a booster dose of the vaccine at 11th grade. And this would align, again, state policy with ACIP recommendations of a booster dose at 16 years of age. And it would also allow for eligible uninsured students to access free or low-cost vaccine under the federal Vaccines for Children program. So when we talked to them about this proposal, 96% of survey respondents said they would support such a measure. So we've heard a lot about HPV, so I won't talk too much here, but I did want to just identify and reiterate and echo, I should say, a lot of the strategies that have already been highlighted around HPV. In the United States, the HPV vaccine is one of the most commonly refused vaccines, and a lack of provider recommendation is one of the main reasons that uptake is low. So those of you who communicate strong but culturally sensitive messages and use your own experience to model vaccinations have had great success with promoting this vaccination. One provider indicated, "My best line is, if I give it to my kids, I will give it to yours. It never fails." And many also offered recommendations on how information should be presented, about reframing the message around HPV as an anti-cancer drug, offering visuals and graphics that show the potential impact of HPV-associated infections. A couple of quotes. "I think graphic examples of HPV in individuals are persuasive, along with an emphasis on the provider's part to educate patients on why HPV vaccine is so important. I reinforce the fact that this vaccine is not about condoning sex. Rather, it's about protecting their child, and who wouldn't want to protect their child?" And finally, participants reiterated the importance of taking advantage of all opportunities to vaccinate, particularly at routine well-teen visits, and pooling HPV into the adolescent platform. "Every family that comes into my clinic and has adolescent teens receives education regarding the HPV vaccine. Even if they choose not to vaccinate, I give them the VIS to look over and reconsider. So the topic of emerging disease is timely, given all the talk about Ebola. However, this is not a new topic. Diseases like brucellosis, cysticercosis, Chagas disease, dengue, leishmaniasis, and leprosy have been in Texas for quite some time, and they are real and growing threats. And we have a very exciting plenary right after ours by Dr. Peter Hotez, who's going to go into all of the details about Ebola and neglected tropical diseases, so please stick around for that. But although these diseases are notifiable conditions, they're not consistently tracked due to misdiagnosis and lack of education. In fact, we surveyed our stakeholders about their knowledge of emergent tropical diseases, and majority admitted knowing a little or nothing at all. Now, although knowledge was low, there was a strong interest in utilizing educational opportunities to learn more about neglected tropical diseases. Over 70% of our survey respondents indicated that they would love to attend a lunch and learn or a webinar, something that could help expand their knowledge and education about these diseases, as well as the process for reporting. And several stakeholders also suggested more detailed monitoring and tracking of these diseases in order to better understand the disease burden, both statewide as well as nationally. So in summary, these are your recommendations. This is what we heard from our stakeholder meetings. This is a long and exhaustive list. Protect mothers and infants from pertussis. Increase the efficiency of MTRAC. Reduce the number of conscientious exemptions that are claimed. Improve immunization uptake among adults. Protect students against bacterial meningitis. Reduce the risk of cancers associated with HPV, and monitor and promote awareness of emerging tropical diseases. Wow, it's quite a list. You guys ready? So this is when we all take a deep breath and remember what inspires us. These smiles are my reminders of what we can accomplish if we take action. And it's no shock to me why the Solomon Islands was voted the happiest place on earth. I mean, just look at that place. Okay. So today, I ask you to take action. Whether you're an educator, an administrator, a researcher, each of us has strengths that can be leveraged, and each of us has spheres of influence that can be mobilized. So remember what inspires you. Remember your stories and your experiences, and then mobilize your networks, your personal, your professional contacts. Talk to each one of them, share your experiences, share your knowledge, share your science. You are the experts. You are the movers and the shakers in the field of immunizations, and you are the ones that can make action happen. And finally, we need to advocate. Those of you who were here on Wednesday heard Representative Donna Howard speak. She's been an amazing champion for immunizations and the immunization registry. However, she's been frustrated, like many of us, with the legislature and its lack of focus on science. In fact, she said that one day she sat down, drew a crude map of Texas, and put a line through it and said, "No science." We need to change that. We need to shift the mentality from no science to yes science. Now, I appreciate that you're all busy, you're all overworked, and you're thinking to yourself, how can I add one more thing to my list? So I'm gonna make it as easy as possible for you. I'm gonna ask you to do one thing that only requires about 30 seconds of your time, and I know there's many of you in this audience who have a smartphone. You could probably do it right now while I'm talking. I'm gonna ask you to go to our website, immunizeusa.org. When you go to our website, click on the Advocacy tab, and when you click on the Advocacy tab, click on Take Action, and you'll be led to this page. And then you'll see that little orange button down there at the bottom that says, Write Your Legislator. You'll enter your zip code, and this is your home zip code, because we want to make sure that you're a constituent and you access the right state senator and representative. You press Submit, and you're led to this page. And on this page, you'll see your state senator and representative. There's a standard letter on the importance of vaccinations, which urges your elected officials for funding and programming and support for everything that's good about immunizations. You can personalize the letter if you want to, or you can leave it as is. We already have it there, ready to go. Fill out your contact information, and boom, you're done. It's that easy. We need your support, and whatever support you can give is deeply appreciated. Now, if you feel like you could do more than 30 seconds, that's great. There's a lot of things on our website, a lot of strategies and tools and techniques for how you can get involved. Contact us if you need it, if you'd like to. We're always looking for passionate immunization champions who are willing to speak up, make their voices heard, walk the halls of the Capitol, meet with your district, meet with your legislators, and support immunizations. When we work in the field of immunizations, we don't always see the fruits of our action. Our successes are invisible. But that doesn't mean we need to stop taking action. So in the words of one of my personal heroes and activists, it's the action, not the fruit of the action, that's important. You have to do the right thing. It may not be in your power, may not be in your time, that there will be any fruit. But that doesn't mean you stop doing the right thing. You may never know what results come from your action, but if you do nothing, there will be no result. So thank you for everything that you do for Texas. Thank you for everything that you do for us. Thank you for everything that you do for my kids. And I'm convinced that together, we can make Texas the happiest place on earth. Thank you.